Resident doctors are striking, again. Across the country, early career doctors are walking out of hospitals, refusing to work under conditions they feel are unsafe, unfair, and unsustainable. But why is this happening? And what does it mean for hospitals, patients, and the future of healthcare? I'm Milo, and in this video, I travelled to London to speak directly with the people at the heart of this crisis, resident doctors. We'll hear what it's really like behind the scenes, why they feel they have no choice but to strike, and what they're demanding from the system they're trying so hard to serve. This isn't just about pay, it's about exhaustion, burnout, dignity, and the future of medicine.
What we're asking is quite simple. We want pay restoration, so that's going up from £18 an hour to £22 an hour. I don't think it's an unreasonable ask, and all we ask is West Streetings come to the negotiating table with a credible offer.
I hate that we have to be out here today. I think the public joins us in being frustrated about this. But we are here because we're seeing a catastrophic step hemorrhage. 20,000 doctors leave the NHS every year, 40,000 nurses leave the NHS every year. And unless we stop that hemorrhage, then the waiting lists are never going to come down. Patient care is never going to improve. And the health and wealth of this society is not going to get any better anytime soon. And so I hate seeing the best and brightest, of this generation of doctors being forced out of the NHS, to work in the private sector, to go work in Canada, to go work in New Zealand or Australia, because pay and working conditions are so much better. I think the government needs to just wake up and understand how critically important it is to have a vibrant workforce here that is well paid and well cared for. And I think they've taken us for granted for a very long time.
If the government were listening right now and you could tell them one thing directly, what would you say?
Our assistants should not be paid more than us. Physician assistants are paid more than doctors. I don't think in any other sector you'd find it where the assistants are paid more than the people that they train with.
Yeah.
So I think it's unacceptable, and all we're asking is just that our base pay goes up. I think £18 an hour to cover hospitals, to do cardiac arrests, to cover an understaffed ward is not acceptable, and just a £4 increase to £22 an hour is quite reasonable, and I don't think it's much of a big ask. I think the issue you've got at the moment is that the cost of striking is more than what the cost of pay restoration is. So even from a cost-benefit perspective, it doesn't make sense to not give us a credible offer, given the fact that it's costing the NHS more per day anyway.
Do you think the public understands the message from the BMA and the doctors who are striking?
I think that when we have a chance to speak to them about it, yes. I think that we had massive public support of the first round of strikes, and I think we're going to be building that back up now. I think that a lot of people see a pay rise of 20-something% as an awful lot, and it is. And a lot of people say, oh, well, we have a pay rise of 20-something%, and you add on another 20-something%, that feels like, oh my God, how much are they getting? And the reason why that figure is so alarming is because that's how much we've lost. Of all public sector workers, we've lost the most money in terms of our pay from 2008 to now. And so, but our fight is the same fight as the nurses, the same fight as the Birmingham bin strikers, same fight as every other public sector worker who has not had their pay increased substantially, while over the last 15 years, while the people over in Parliament have had 9 pay rises, something like that.
Yeah.
It's ridiculous. Are paid £18.50 per hour.
Yeah.
That is absolutely ridiculous. And then we're asking for £22-23 for them to start on. There is everything right about that, everything appropriate about that, and that's why we're fighting for them.
Do you think it's still worth it to enter the medical profession at this point in time?
Yeah, I think look, we enter the profession to help people, not for pay, but at the end of the day, we still have to pay bills, and I think it's important.
Feel valued.
Exactly. So when you go to the ward and 2 other doctors aren't in, or they've left the profession altogether, it's quite demoralising to see.
You had any words to say to any medical students who are just entering maybe their foundation years now?
Yeah.
What advice would you give to them?
Carry on, persevere, be active in the BMA, fight for your rights, don't let things degrade and get to the point where it has now.
Yeah, thank you very much for your time.
No worries. Thank you.
Cheers.